This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub Podcast. I'm Dr. Aris, a senior attending here, and today we are diving into a topic that remains a classic challenge in our field, the management of third-ventricle colloid cysts.
And I'm Dr. Elara. Today we're looking at a fascinating new study from the journal World Neurosurgery 2026. This is a retrospective single-center series titled Microsurgical Outcomes of Third-Ventricle Colloid Cysts Treated via an Interhemispheric Transcallosal Approach, Clinical and Imaging Correlates.
This paper is particularly timely. Colloid cysts are relatively rare and benign, but as every resident knows, they are high stakes. Even a small lesion in that strategic location can lead to acute cerebral spinal fluid obstruction.
Exactly, Dr. Aris. The study really emphasizes that risk. They note that these lesions can cause rapid neurological deterioration and, tragically, sudden death. Because of that, the focus isn't just on the surgery itself, but on identifying the clinical and imaging correlates that tell us which patients are at the highest risk.
Right. Now, the authors focused specifically on the Interhemispheric Transcallosal Approach. In the current debate between endoscopic and microsurgical techniques, this paper leans heavily into the microsurgical outcomes. What were the primary aims they outlined?
The study aimed to evaluate the clinical presentation and imaging characteristics, but what I found most interesting was their emphasis on age-related patterns of clinical presentation. They wanted to see if the way these cysts manifest changes as the patient ages, and how that correlates with what we see on the MRI.
That's a crucial point for the residents listening. Often we think of colloid cysts as a one-size-fits-all diagnosis in terms of presentation, headaches, maybe some gait changes. But if there are distinct age-related patterns, it changes our index of suspicion in the ER. Did the paper go into detail on those correlates?
It did. They looked closely at how the imaging characteristics, things like cyst size and signal intensity, aligned with the patient's age and their acute or chronic symptoms. By looking at a retrospective series, they were able to track these postoperative outcomes over time to see if the transcallosal approach provided the stability and clearance we expect.
Let's talk about that approach for a second. The interhemispheric transcallosal route. For the medical students listening, why this approach versus, say, a transcortical route?
The paper suggests that for these third ventricle lesions, the transcallosal approach offers a direct line of sight to the roof of the third ventricle without requiring a large cortical incision. The study highlights microsurgical outcomes, which usually implies a focus on total resection and the management of the internal cerebral veins.
And in this series, the authors are looking at how those outcomes correlate with the initial imaging. One of the takeaways for the practicing neurosurgeons is the imaging correlates. When we look at a cyst on a T2-weighted image, or a CT, we're often trying to predict the consistency of the cyst, whether it's liquid or more tenacious. This paper tries to link those findings back to the clinical urgency.
And that urgency is tied back to that rapid neurological deterioration mentioned in the abstract. If the imaging correlates suggest a high risk of CSF obstruction, the microsurgical outcomes in this series show that the transcallosal approach is a robust way to address the pathology definitively.
It's also worth noting that because it's a single-center series, there's a level of consistency in the surgical technique. They aren't just looking at whether the patient survived, but at the clinical correlates, meaning did their symptoms actually resolve? Did the age-related patterns they identified preoperatively influenced how well the patient recovered postoperatively?
It really highlights that even though these are benign lesions, the term is a bit of a misnomer given the potential for sudden death. The retrospective nature of the study allowed them to really categorize those clinical presentations. For a fellow like me, seeing how they broke down the age-related patterns helps in counseling patients. A younger patient might present very differently than an older one with the same size cyst.
Absolutely. So to wrap up our look at this 2026 World Neurosurgery paper, the takeaway is clear. Third ventricle colloid cysts require a nuanced understanding of imaging and clinical correlates. The interhemispheric transcallosal approach remains a powerful tool in our microsurgical armamentarium for achieving excellent outcomes and preventing that feared rapid deterioration.
It's a great reminder that in neurosurgery, the details in the imaging often tell the story of the patient's future.
Well said. That's all for today's episode. To our residents and students, keep studying those scans. We'll see you next time on the Neurosurgery Hub Podcast.
Thank you for listening.